This is the second webinar of its kind, collaborated with Translators Without Borders and IOM. The first was last year, 2019, following a training for interagency PSEA coordinators, where there was great interest on this topic arising from the participants. And it went very well, so we decided to have a follow-up second webinar for people who are working on SEA prevention and response on the impact of language in the work that we do. So we are very fortunate to have the expertise from colleagues in Translators Without Borders, TWB, which is a US registered nonprofit working to overcome language barriers to knowledge. And our expert presenter today is Alice Castillejo, who is Program Advisor, and Mia Marzotto, Senior Advocacy Officer for TWB. Alice will be our main presenter. She works with TWB's Global Crisis Response Team, which supports humanitarian organizations to communicate more effectively with the people they seek to serve. Alice began her career in civil societies organizations in the UK, from which she moved into international development and humanitarian sectors. And she began her international work in Pakistan in 2004, followed by Cambodia, South Sudan, and Myanmar, which we're all going to learn the lessons of her experience today. She has been with TWB for the last 3.5 years. Mia, her colleague in Translators Without Borders, is also in the Global Crisis Response Team. She has supported field teams from Maiduguri, Cox's Bazar, Beira, and Goma in the last 5 years. Her past roles include working with Oxfam on media and advocacy in the occupied Palestinian territory in Israel, and on advocacy and outreach around the refugee response in Italy, and where she is currently based. So that is an introduction to our speakers and organizers. A little bit of housekeeping before I hand over to Alice to take us through the webinar for today. So you can see now that everybody is on mute. That is to keep the recording clean. At the moment, the chat function is disabled. We apologize. What we will do is hang on to your questions throughout Alice's presentation, which will cover the first part of this session. There will be plenty of time for Q&A, so hang on to your questions, at which point, when Alice's presentation is finished, we will unmute everybody and go through. You'll have the opportunity to raise your questions then. If at any point the chat function is enabled, please feel free. We'll give you a high sign and please feel free to post your questions there. And finally, this session is being recorded. If you would like to receive the recording from this webinar and the presentation that Alice will give, Alice and Mia's emails will be displayed at the very end. You can write them directly to request the recording. If we're able to get the chat function enabled, then if you write your email into the chat function, then Translators Without Borders colleagues will send you the recording after. That is it from me. Very happy now to hand over to Alice. Thank you.
Thank you, Alex, for the introduction, and thank you everybody for being on the line. We're really delighted to give this webinar today. So, Mia, if you could move to the next slide, please. So I'm going to spend a little bit of time today just talking about some of the lessons that we have learned over the last few years from our research and practice, and what it's taught us about the language issues in the humanitarian sector, and particularly on how they impact on the effectiveness of preventing sexual abuse and exploitation. I'm going to obviously talk about some of the major challenges so that we all understand what they are, but I am going to try and make sure that we focus as much as possible on what some of the solutions are. As Alex was saying, I'm very happy to take questions at the end of the presentation. And of course, we'll be very happy to send the presentation to anybody who needs it. So, first of all, I'm going to talk about language as a driver of vulnerability. Mia, could you go to the next slide, please? So, in the humanitarian sector, we're very used to looking at factors such as poverty and gender and age and disability as drivers of vulnerability. But language and vulnerability are interconnected. Speakers of marginalized language often experience multiple layers of disadvantage: access to education, access to healthcare, nutrition, rights and representation, and in particular, access to technology. As each driver of vulnerability compounds the next, in many societies, women get less access to education and therefore fewer chances to learn other languages. Maybe older generations have not benefited from the educational opportunities that younger people got, and therefore, again, will have had less opportunity to read and write and speak an international or a national language. And poor education or provision for disabled people might, in many countries, have limited their communications options. So an impoverished woman with disabilities who speaks a marginalized language could be the very last person to get to know how to report sexual exploitation and abuse, or how to access services if she needs them. So this means that marginalized language speakers can be some of the people that humanitarians most need to reach to prevent sexual abuse and exploitation, but can also be some of the most difficult. Next slide, please. To meet the CHS standards, service provision needs to be impartial and relevant and based on participation and feedback and avoiding negative effects. But if humanitarian responders can't properly communicate with marginalized language speakers, they can't possibly be impartial because they can't identify the needs of those groups, and they might not be able to provide services to them, and they might not be able to get their feedback. So neglecting marginalized languages may not only be exacerbating ethnic tensions or traditional patterns of exclusion, but it might be that failing to tackle language will exacerbate vulnerability and inhibit reporting. From the CHS Alliance Humanitarian Accountability Report of 2020, we know that the lowest scoring commitment is commitment 5, which states that complaints should be welcomed and addressed. This is of deep concern, and it shows that we're going to face a challenge about how we listen to the feedback and the concerns and the complaints of people that we're supporting. It also shows that despite acknowledging the huge challenges the sector faces in protecting people from sexual exploitation and abuse, the real efforts made to strengthen these protections, there are still systematic weaknesses. If people don't know how to complain about their treatment, organisations are less likely to put a stop to that abuse. And taking languages seriously is absolutely crucial to achieving those commitments. Next slide, please. 234 million people need humanitarian assistance. And I suspect that's a number that we took before COVID came along and increased it significantly. Many, if not most of them, sit behind a wall with their needs invisible because of the languages they speak. To understand what we need to change, it's really important for us to understand what we're failing to do. We can more or less break these down into not knowing what languages are spoken and by whom, and over-dependent on unsupported local staff and partners, language barriers that are compounded by low literacy and a lack of attention to terminology. We're going to look at each of those in a bit more depth. Can I have the next slide, please? On average, people speak about 47 languages in each country around the world. And as you can see from the map, that really is an average. In many cases, there are a lot of languages in some contexts. The humanitarian community, however, operates mostly in English and to some extent in French, Arabic, and Spanish. While we have traditionally been very aware of language as a factor in reach and effectiveness, we really have struggled to address it in terms of accountability in our programs. The map here shows linguistic diversity around the world. With the darker the country, the more linguistically diverse its population. But what there is no good reference for what languages are spoken where, and no authoritative and up-to-date and freely available complete language set for each context. So we generally only know which languages we need to be communicating in to reach affected people if we gather that information ourselves. And we don't, or not routinely. Organisations that do collect language data on occasion don't routinely share it. And as a result, we're much less likely to see language as an issue, and we lack the evidence base to plan to do something about it. If we don't collect the data on language because we're not aware of it as an issue, and therefore not having the data, we're less likely to become aware of it. And that missing data is absolutely crucial for us. Next slide, please. One note on protection. People are often very concerned about gathering data on what language people speak. The main concerns about sharing language data are related to the links between language and the potential backlash against affected people on that basis. It's mostly seen as an issue in situations involving refugee populations, where the language people speak is an indicator of their country of origin or ethnicity, and that might put people at risk. If we're to balance the risks of sharing information with the risks of not sharing it, I believe we should look at them on a case-by-case basis and come up with a workable protective solution. Protection specialists should definitely be involved in assessing the risks and designing mitigation measures. And our own language mapping work, the key principle that we've used in TWB is to collect household level data, but only to share aggregated data analysis, and that only at the level that organisations need it to plan their communications. So for example, in Northeast Nigeria, that's been at site level, or in Mozambique, that was at province level. Good practice on information and data management are also key, of course, and again, case-by-case analysis is important to make sure that protection specialists be part of the solution. At the end of the presentation, I'm going to put up some resources, and that's going to include several sets of guidance around the safe management of data. Next slide, please. In the cyclone responses in Mozambique in 2019, for example, aid organisations typically attempted to communicate with affected people in Portuguese. But as this map shows, in the province most affected by Cyclone Kenneth, just 1 in 5 women understands Portuguese, and even fewer can read or write. That's why collecting data and sharing it has been so important in developing a language strategy. And there are solutions. In the northeast of Nigeria, TWB and the IOM DTM team and REACH have all worked together to make sure that language data was collected and mapped. And the result was a series of detailed language maps by camp, by local district, and by language. That work might sound daunting, but what it really needed was to make sure that a few very basic questions were added during routine data collection. Questions like, which language do you generally speak at home? Or which language do you prefer to receive written information in? It doesn't really have to be so hard to collect that basic information. It's just really important that we start doing it. As part of TWB's work in the cyclone response in Mozambique, we mapped pre-existing language data for the most affected provinces. As you can see from this map, we conducted an assessment on people's languages and communication preferences. Responders to know what languages and formats to use to communicate with crisis-affected people. WFP then put that data to use to scale up its hotline from a single agency line to a multilingual interagency complaints and feedback mechanism, and call centre agents represented 12 out of the 14 most spoken languages in the country. In addition, with 39% of the population being illiterate, WFP used pictorial communication to raise awareness of the hotline, especially amongst women, and feedback from women in affected communities identified that the fear of not being understood or not understanding the call centre was a significant barrier to accessing the line. It's a language-related fear that WFP is working to address through a range of communication channels, including graphic and audio communication. Where agencies collaborate to gather language data, like we did with IOM in Nigeria, and to share it as TWB has done here for the cyclone response in Mozambique, we can see how much more precise communication strategies can become. Next slide, please. Moving on from data, the next major issue is, in general, that we rely very heavily on largely untrained and unsupported national colleagues. It isn't really surprising. When a new emergency starts, there often doesn't seem to be much choice, and a lot of languages don't have a big pool of professional translators and interpreters ready to mobilize immediately in an emergency. And it's a credit to everybody that the effort is made to work in local languages. But we do need to understand the limits of this and to make sure we know how to address it. We often don't budget for professional language support, nor do we cost up what resources our local colleagues are going to need to build their translation skills. We rely on our national colleagues to do most of our interpreting and translation largely without training and guidance, and that is problematic in a number of ways. Firstly, without the background information on what languages are spoken by crisis-affected people, we don't actually know if our colleagues have the right languages to communicate effectively with them. In cross-border responses in particular, it can be very hard for local staff and partner organisations to have the right skills, and it can be hard for staff who need to work to admit that they are struggling to communicate. The next challenge is that we add translation and interpretation to our national colleagues' workloads without factoring in the time that they need for that, and the need to support them with training and resources so that they can do it successfully. And then crucially, local staff are often relied on to tell responders what languages are spoken in the affected area. But both staff and partner organisations often come from the majority language groups. After all, minority language groups may well have struggled to access the education system. So the most qualified people we can find are likely to be majority language speakers. And that means that they will have come with their own backgrounds from that particular group. If you can imagine a crisis that affects the city where you live right now and you were called on tomorrow without any access to the internet to know what languages were spoken in the area and to estimate the number of speakers in their locations, could you do it? Because I know I couldn't. Can I have the next slide, please? Thank you. Let's just take an example of this. Let's look at the over-reliance on unsupported staff from the perspective of the Rohingya refugee response. Here, language diversity is on the side of the responders. The biggest communication problem has been the assumption by aid agencies that Chittagonian, Rakhine and Myanmar languages, spoken in Cox's Bazar and the Rakhine region of Myanmar, are well understood by the Rohingya community. Largely, national staff depended on local colleagues to inform them of the language needs of the community. And the figures on the slide that I show were taken from a survey of over 170 international and local humanitarian staff and more than 600 Rohingya community members. So as you can see, the difference in understanding of what the languages people really spoke and the languages that their community spoke are huge. In this example, an over-reliance on local staff led to the assumption that they could be understood. And there was a lack of attention to the details of the differences between the languages, leading to potentially dangerous misunderstandings. Interpreters in health centres didn't recognise, for example, that the word chest was being used as a euphemism for breasts. So medical staff didn't get an accurate information as a basis for making decisions. And TWB's sociolinguistic research shows that the same word, mayafua, means both young girl and adult woman, and that was potentially skewing a response-wide data to the number of children in households. Next slide, please. Thank you. So what is the solution to this issue of dependency on local staff? Well, the first one is if you've gathered the language data, you can recruit staff specially to match the languages of the community you're serving. And the second thing is to acknowledge the role around translation and interpretation in people's job descriptions and factor in time to their workload to do it. It's important that people who are doing translation have time to be able to work on this task. Training interpreters in interpretation skills is really important, rather than just assuming that a bilingual person can do it without thinking. And work across the PSEA networks all together to release staff time for collaboration around glossaries and terminologies and language can be a really important way of developing staff skills as well as building the capacity of the sector as a whole. Next slide, please. The next challenge I'm going to talk about is where vulnerability is compounded by low literacy. It's fairly obvious. If your audience cannot read your materials and cannot write their concerns down, you need to start getting creative about other approaches. Next slide, please. Thank you. Safe and accessible complaint mechanisms that can handle SEA complaints are the priority of IASC and the ultimate responsibility of the humanitarian coordinator under accountability to affected populations and PSEA commitments. But making those truly accessible is a tough challenge. Camp residents and humanitarians interviewed by TWB in displacement sites in Mongono in Nigeria reported that feedback mechanisms are not accessible to everyone. This was linked to both language and literacy. Most humanitarian workers deployed in Mongono speak Hausa. That's not their fault, of course. It's due to the assumptions made by organizations that Hausa will be understood by everybody. But many people do not have confidence in Hausa to make a complaint or discuss a concern. This disproportionately affects women, and many women have said they feel more stressed and less confident when speaking with humanitarian field workers who only speak Hausa. The alternative feedback mechanism is a complaints box, and that requires the person reporting to provide written information. Extrapolating from our findings on written comprehension in Mongono, it seems likely that at most 10% of our sample could have written their feedback. Even when someone does give feedback, the same barriers of language and literacy can prevent them hearing what action is taken. So communication barriers are preventing humanitarians from closing the feedback loop. And it's not surprising that camp residents spoke of a lack of faith in the system. In Mongono in northeast Nigeria, two-way communication with affected people remains a work in progress. Next slide, please. One thing to consider is voice-based solutions. In the case of northeast Nigeria, IOM is trialling the use of voice recorders as community feedback mechanisms in IDP camps. People can record their comments in their own language inside a private booth. TWB then transcribes the feedback and translates it to English for analysis and follow-up. Initial learning shows that many marginalized speakers, especially women, do feel comfortable sharing their feedback for the first time through these voice recorders. In the case of the cyclone responses in Mozambique, the move to voice-based multilingual hotline improved accountability for those who are less literate. And good practice can include supporting safe shelters and trusted programs for in-person reporting. This could involve checking that staff speak the languages of the community and mapping the languages available of the different service providers, so that people, when they're being referred, could get referred to an agency that speaks their language. It's likely also to involve training more staff in using sensitive terminology and recognizing common euphemisms. Next slide, please. The other thing that's important to consider is to test and use pictorial information. You can use images to raise awareness of sexual exploitation and abuse, but be really sure to test them carefully. TWB's research on images tested in northeast Nigeria met with a cautious welcome and some concern from local community members. They welcomed the idea, but they wanted to see more versions of the images, and there were differences of opinion between men and women about what was appropriate to show. Working closely with a local illustrator, CDAC and Translators Without Borders developed and pre-tested a series of posters with communities, 3 posters in the official language Portuguese, and 3 mother tongues of Chiwobo, Nadu, and Sena. And these were tested to support there was support to dissemination efforts, and we can see one of them in the slide there. Next slide, please. The next issue that I want to talk about is that when talking about the prevention of sexual abuse and exploitation, we're hampered by terminology. If we think for a moment about how we use, in our own cultures, how we use terms to show status and give respect and hide our embarrassment, then we begin to understand, just beginning the challenge of understanding how much terms matter. Let's take, for example, some examples from the women's world. We need only think about the words that we use to discuss menstruation, and then we might think how we choose terms differently if we speak to a doctor or we speak to our friends. Then let's think about how we talk to children about our bodies or about sexual issues, and we see how we might have different words again that we would use with children from ones that we would use with friends and with doctors. And then, of course, we can all think about the many crude terms for body parts and sexual acts that are used constantly as insults. So we need to be careful when we design our materials and our communication efforts to make sure that we're not hiding our own embarrassment by using the most medical terms, because they may not be very well understood. If we're not hiding our own embarrassment through medical terms, can we be sure that our translators are not doing that for us? And can we be sure that the terms that are being used are commonly understood and are not implying some other meaning? Next slide, please. Class.
Alice, we might have lost audio from you. We'll try to reconnect.
Alice is on mute. It appears that Alice has been dropped. She will return momentarily. Alice, no, we are not able to hear you. It does still say that your mic is muted. Thanks for bearing with us, everyone. Alice is going to try to disconnect and reconnect.
Okay, I'm back in the call again now. I wonder if you can hear me.
We can. You are welcome back.
Wonderful. Okay, sorry everybody for that. Okay, I'm assuming you're all seeing still the screen where it says young women are ashamed to speak. So I'm going to continue on that slide. So using euphemisms, as I was saying, can be important and useful, but it's important to make the choices, to understand them and to make the right choices. So, the onset of menstruation with Rohingya girls, for example, aid organisations need to make a deliberate choice between which euphemism they want to use. One essentially means becoming big, and the other means entering the house, implying that the girl will now be restricted in her movement and social interaction. Using euphemisms can be useful and important. For the Rohingya community, for example, the English word for rape has been adopted, but a euphemism loosely translating as forced oppression is considered less stigmatizing. Likewise, to describe homosexual sex, organizations might choose to use the euphemism using a substitute as being less pejorative than the alternative one, which is bad, although they're not going to find a word which is not pejorative at all. In lots of ways, other words can be problematic in many cultures and many languages. Marital rape and paedophilia can both be difficult things to describe and translate, especially where marital duties may be seen to include sex or where child marriage is permissible. We have come across many times things that are hard to translate. The Rohingya language didn't have a term for gender, and so it was translated as which meant that gender-based violence was translated as violent women. In northeast Nigeria, being a widow can be so stigmatizing that in some languages, the word for it is best avoided. And about a quarter of Hausa speakers that we surveyed didn't understand the standard Hausa term for rape. Also, the acronym itself, SEA, meaning sexual exploitation and abuse, has been translated as in sea or ocean in some documents. Next slide, please. Thank you. Class and gender are the other things which deeply affect the words that we use. In TWB, our first translations in northeast Nigeria came from people from Maiduguri University. And it wasn't until we tested our early translations that we found out that the Hausa that was being used was so elegant that it really could not be easily understood. In one terminology testing workshop, a WASH field worker in Maiduguri, who was a male staff member, reported that he thought that women in the area he had surveyed had no idea what sanitary towels were. His female colleagues burst into laughter and teased him endlessly and offered him all the slang words that he'd never heard before and which women used with each other. So, what is the answer to this thorny problem about terminology? It might seem a little bit old-fashioned, but one of our answers is glossaries. You'll find that TWB has already created many multilingual glossaries, which are on our website. But where these are not ready for you and not in the language you need, discussing terminology and agreeing non-stigmatizing words and sharing them and using them consistently can be achieved within a PSEA network without specialist intervention. The process of gathering and discussing terms and nuance can be an excellent way of building the capacity of teams who work in translation services across PSEA networks. Next slide, please. But finally, in terms of terminology, we mustn't forget the elephant in the room. As humanitarians, we need to be aware about our own terminology. If you try and read a humanitarian guide with the eyes of somebody who's not from the sector, they're really difficult. They're mostly dense and full of jargon and sometimes very dull. We use words like safeguarding and intersectionality, mainstreaming and mitigation. These are words that the average the average native English speaker is going to be struggling to define. But we want our colleagues to understand and complex ideas with almost no language support. We also know that there's a lot of legal minefields in our choice of words, and this means we need to help our translation teams. The words that we use need to be both clear and simple so that they can help us express the legal nuance while still being understood. In this, plain language can help. Next slide, please. Plain language is a recognized discipline of writing, which helps the reader understand as quickly and easily and completely as possible. If you use plain language, you try to make your message clear, present it in an organized way which makes it easy for the reader to find what they're looking for. It favors short sentences and familiar words. TWB has a plain language editing team, and we regularly deliver on training on writing in plain language because we strongly believe it helps all of us, whatever our educational level or literacy, to reduce our reading effort. Not only this, but the clearer the original document, the stronger any subsequent translations are likely to be. Next slide, please. Here we have two parallel texts, one of them of one of the PSEA key principles. TWB worked with the IASC team responsible for the principles to create a plain language version, which was easier to understand. And we've gone on to translate those into 100 languages. I'll share the link to those at the end of the presentation. But the process wasn't without its challenges. We had to consider our choice of words carefully. After much discussion, sex worker became prostitute. Despite the stigma associated with the word, in the end, it was felt much more likely that it would be understood, and we had to choose comprehension over the risk of causing offence. Our efforts to create a plain language version of the principles identified that in several areas, the original version had such complex language that it had unintentionally hidden the meaning. So different agencies actually had a different understanding about what it meant. We don't actually advocate for creating an original text and then a plain language version. We believe that all humanitarian materials should be written from the outset in plain language. It improves the clarity of the message, it reduces the reading effort for everyone, regardless of their educational level. And we, and that includes you and me and everyone else, all our colleagues, should only need to read something once to have understood it properly. At the end of the presentation, I'll also share some guidance where you can find out about writing in plain language. Next slide, please. So we've looked at data, we've talked about supporting staff, we've talked about terminology, and we've talked about plain language. I'm going to take the next few slides to look at how these have been knitted together into really successful solutions. When Translators Without Borders arrived in Cox's Bazar in late 2017, we found that the conservative nature of the Rohingya culture and the non-standardized nature of the Rohingya language made it really difficult for program teams to discuss sexual abuse with male and female refugees. We also found that the refugees' biggest barrier to giving feedback was not knowing where to go, and that this was particularly the case for women. Since then, we've provided response-wide language support as part of a common service for community engagement and accountability. In that time, the proportion of refugees feeling that they have enough information to make decisions for themselves and their families has steadily increased. So the proportion of refugees knowing how to make complaints about the aid that they receive and other concerns has also increased. Our language support has included gathering language data and testing comprehension to make sure to understand to what extent Rohingya community understood other relevant languages. Conducting sociolinguistic research to build a better dialogue around gender issues and other sensitive topics, and sharing these in the form of a glossary, which has over 200 gender-related terms, as well as terms for other sectors. We have developed a training program for staff to help them be aware of the language pitfalls when discussing when collecting face-to-face feedback from refugees who would otherwise be prevented from giving it by language barriers or low literacy or social restrictions for meeting outside the home. And we've been translating and analysing feedback from various partners, which is regularly consolidated and shared with organisations across the response via a regular monthly bulletin called What Matters. Next slide, please. In collaboration with the PSEA network and other partners, we've developed key messages in relevant languages and formats that have been disseminated through various channels in the camps. And we've produced localised plain language audio training materials in Rohingya, which have helped volunteer refugees understand humanitarian commitments on preventing sexual exploitation and abuse. All these resources are available in a platform which I'm happy to share the link of later. It should be noted that since the onset of COVID, women's movement in the camp has been restricted, and in return, this has reduced their access to information about the virus. This is in contrast to men who continue to leave home for work and essential shopping. As a result, women increasingly rely on male family members for essential errands and information. Through our ongoing research, we found that women expressed a need for aid providers to make more frequent block visits, voicing a preference for face-to-face dialogue. Some find it more comfortable and convenient to provide feedback within their immediate environment than to have to seek out a representative in another location. And this is also an indication that the community feedback data that cases of gender-based violence may be increasing. Clearly, this is not a perfect success story, but it highlights some important lessons and solutions that can be applied elsewhere. Next slide, please. So, if we look at the solutions, wherever you are, there are some resources that can help you. There's census surveys and online resources which might provide you some information on what languages are spoken in the area where you work. You'll probably need to collaborate with the network to gather more locally relevant data, particularly in cases of population displacement. If you disaggregate reporting and service use by mother tongue, it will help you build up a picture of who isn't reporting or who cannot access services. The key PSEA messages are already in more than 100 languages, and so there's probably one that's relevant to you. But if you find the need for another, please do contact us. At the outset of an emergency, you can begin straight away doing glossary development and sharing this across the PSEA network based on all the learning that takes place. This is something that we can help or advise you on if you need it. Join together and try and advocate for plain language use across the PSEA network, as well as in humanitarian sector as a whole. At least make every effort to use it yourselves and in your agency. There are several agencies who can support on training interpreters and translations. whichever country you're in, there's likely to be in a professional association who may not have the particular languages you need, but might have the training mechanisms. TWB can also offer short targeted training on the basics of humanitarian interpreting, either where you are on the ground or where there's a network or individual agencies you want to bring us in for an injection of capacity building support. TWB works in language pairs and can work intensively with PSEA networks in multilingual contexts to provide research and guidance and a range of language services to support the network. And these can involve in-depth research on how to talk to people about these sensitive subjects, but also practical support to make reporting more multilingual or to test the comprehension of the messages being developed. Next slide, please. As I said, I'm ending with a set of resources. We're not going to keep this slide up for very long, but it will be available, obviously, once we upload the presentation online. There are lots of places you can go for information and for resources. And increasingly, many of those resources themselves are becoming available in multiple languages. And that can help everybody to access them from all different language groups and contexts. Final slide, please. So this is the end of our presentation, and I want to say thank you again very much for inviting us and open the floor for the question and answer session, which I know is going to be coming up next, in which both myself and Mia will be very happy to answer questions.
I'll jump in right here, Alice. This is Alex. Thank you so much for that presentation. It's incredibly eye-opening to consider how just even being aware of the assumptions that we make can be a first step towards plain speaking. So thank you for the challenges, the solutions, the knowledge that you brought. We are now going to take people off mute. So if you have a question, you can unmute yourself. Raise your hand if you have a question. We already have one in the wings, and Mia will field the questions for our Translators Without Borders colleagues. Over to you, Mia.
Thank you, Alex. Yeah, so if you want to raise your hands, and then we'll do questions like that. Sorry if the chat function is not available. So I do see a couple of hands up already. Zveztina, and sorry in advance if I mispronounce your name. But yeah, okay, then now I don't see hands up. Okay, so maybe can we start with Georgina Lund?
Hi, yeah, thank you so much for that presentation. It was really interesting. I had quite a specific question around language being used, and I wondered if you had any experience or if you could give any best practice tips on how you might have worked with governments in the past around explaining language around safeguarding and PSEA, and if you have any examples of where you've had to work with organisations to nuance language so that safeguarding policies or PSEA policies have been accepted by governments or authorities in countries that have quite a traditional approach to language, especially and quite a conservative one, so not using language such as, you know, sexual exploitation and abuse, and how you kind of, any guidance that you might have on marrying the objectives of ensuring that your safeguarding policy still meets your minimum requirements of, you know, zero tolerance and being very explicit about the content, but also ensuring that you're nuancing it so that governments and authorities will accept it as a document. Thank you.
Thank you. That's a very interesting question. I think I'm going to probably look to Mia to support me on this one, because I'm yes. So to start off on the issue of government, I'm not sure that we have had direct experience of working with governments, but in terms of a nuance, I think one of the things that we've done is worked with practitioners and brought people together from a number of agencies, and that's included government agencies, to talk about language and try and find a shared platform on which to agree terms that are going to be acceptable and what ones aren't. But I do know that we've also had research that has had to stop because the government wasn't prepared to allow us access to discuss the issues and to get the data around language. Mia, I'm just going to open the floor to see if you also have had any experience in particular of working with government or finding solutions.
Yeah, no, I think that sums up our experience in a way. I would perhaps add that we're not here to claim that language is a fix-all solution. There's definitely quite a few elements to take into account, and language is one of them. I would say, though, that in my experience, the use of plain language has been quite useful in making sure that at least everybody around a table agrees on what we mean by certain concepts, on what we mean by certain commitments. And so that might be something to keep in mind also when engaging with actors who might not necessarily be on the same page and what PSEA and certain provisions should look like.
Thank you very much.
Thanks.
Thank you. So maybe Nemia, would you like to go ahead with your question?
Hello, everyone. Thank you so very much, Alice and Mia, for a very enriching session on TWB, and thanks, of course, to Alex and the team for organizing this. My first acquaintance with TWB was when I was a PSEA coordinator in Congo. And I really, I'm grateful that, I was so impressed of the efficiency. Would respond to requests. I was in touch with Ellie Kemp at the time, and I don't know, Alice, I think at some point we also talked about it. TWB came back to us with pro bono translation of the Code of Conduct, and that was the first time that I encountered the word plain language, which now at our session I had a clarity. I have now a clarity of what you mean by plain language, and it is a very important point to remember, I think. My question really and my comment is that I understand that TWB is kind of running on voluntary services, and really this is a very impressive commitment that the team of TWB has. And I know that in very big volume of documents to be translated, like at some point we were thinking of translating professionally the documents that we developed for training of PSEA coordination in North Kivu. And I was then discussing with TWB how we can have a relationship on this. And I understand that because you don't have a kind of funding, then for those who may have voluminous documents for translation, we have to kind of put up a fund from ourselves, from the agencies who may have the need for translation services. And I understand there is a kind of a framework of agreement that can be drawn between TWB on the basis of how many pages, how many words would need to be translated into different languages. So I just would like to know more about where at the point you can provide kind of pro bono service, and at what point do we have to draw an agreement that could be paid by agencies if we have to kind of request for the services of TWB. Thank you, Alice and Mia again, and that is my point from this side. Over to you.
Hello. Happy to answer the question as fairly briefly. Yes, as you say, we need to charge for most of our translation services. It's very rare that we're able to do pro bono work. There are different sizes of partnership kind of packages that we tend to have, depending on the size of the organization that we're partnering with and their translation, the complexity of their translation needs. It is something that we need to go through with each individual partner to be able to decide what package is appropriate for the level of kind of needs that each organization has. So I would very strongly recommend getting in touch with us directly, and we'd be very happy to guide you through the various different partnership plans that we have and see which one meets your needs the best. I realise that we need to share our details with you, and we'll find a way of doing that towards the end of the presentation.
Thanks, thanks, Alice. Well noted.
Great. If I could ask maybe Aude, if you would like to unmute yourself and ask your question.
Hello, hi. Hello everyone. So yes, my name is Aude, and I was wondering if we had the new PSEA principle translated in French or other languages, those that were updated in 2019, September last year.
Question. I'll address that one straight away. We have started the process of trying to get a plain language, an agreed plain language version. And during that process, it has become apparent that, in fact, some of the major agencies didn't have an agreement about what it really meant. And I think I was saying previously in my example that it was written in very complicated language, that fourth principle. And when it came to it, it turned out that two different agencies had a very different understanding of its exact meaning. So until we can arrive at a consensus on what it really means and get that described in plain language, we're not able to do the translations. But we are working on it, and we really hope to be able to get it soon, and then of course to be able to put it into as many languages as we can.
Thank you so much. This is really helpful. Thank you. We're looking forward. Thank you.
Great. Perhaps Tayu Niende, would you like to ask your question?
Yes. Good afternoon, everybody, and thanks to the presenter for the really, really interesting and inspiring presentation. So you made a recommendation which is really intriguing, and I think that you raised an example somewhere actually when you talk about creating audio feedback and reporting channels. But I'm not quite sure I understood how this works. I would be grateful if you could just explain a bit more how this works and how this addresses the issue of language. Thank you. Over.
No problem. Thank you. Great question. Okay, I can give two examples. One is in northeast Nigeria, where because there's poor connectivity, what we've done is we've worked with IOM to create like a recording machine. Like, it's not a very sophisticated thing, but we've built one that's very sort of unbreakable recording machine. So people hit a button, and then they can leave whatever feedback they want to, and it's in a small private booth, and there are instructions, pictorial instructions on how to use it. So people can go in, they can record a message in any language of that area. The messages then get collected frequently and given to Translators Without Borders, where we'll transcribe them and translate them and give them back to IOM, so that IOM can get those in a language that they can speak. So it goes usually into English and into Hausa, and they can then address the issue and working through interpreters get back to the individual. We also really have worked in some areas to try and encourage a voice feedback, so closing of the feedback loop, so that people can say, you know, this month, I don't know, there were 20 complaints about this, or 15 people raised the following concern, and that can be an audio recording that can be played through loudspeakers in the camps, saying, you know, this is what we've done about the concerns you raised. There was a concern about this. We've done this about it. So it can be it can close the feedback loop in audio terms, as well as getting back to individuals. In other places, we've supported multilingual telephone lines, basically. Mia, is anything else to add to that?
Yeah. Thank you so much.
Pleasure.
That sounds great. I'll just pull up our contact details in the slides. Just give me a second. Here. Amal Hussain, would you like to go ahead with your question?
Yes, thank you. And thank you for this very useful seminar. It's really eye-opening. My name is Amal. I'm from the OPT. I'm a national officer. So here, although we don't have, we're not working in different languages, we have basically Arabic. But one of the challenges that we really face is stigma in relation to the language. And so we need to be very careful about the language that we use, etc. I was wondering in this context, given that the stigma that we face, especially in the Arabic-speaking regions in general, but in the cultural issues, etc., insofar as it relates to using plain language, and also given that we are moving towards or trying to shift towards an all-inclusive approach on AEP and PSEA included, I was wondering if there has been, like a steer towards kind of grouping AEP and PSEA together so that, the language or the messaging is addressing stigma as well as using language that's can be easily user-friendly and can be easily understood by by community members. So that's one. I also wanted to see if you had any thoughts on protracted emergencies that may heighten, where you have like a full-blown escalation, hostilities, and do you recommend any basic complaint channels for that situation? Because in many instances, internet is, there's no access to the internet, even like phone lines could be compromised, etc. And lastly, just wanted to see if there were any thoughts on the challenges with outsourcing surveys. So here in the OPT, we have service providers that would carry out and fill surveys on behalf of humanitarian actors. And this kind of, what you were saying, all the very excellent points that you have been raising kind of raise the issue of, what do we need to do in order to ensure that our service providers, insofar as surveys are concerned, are actually well trained to use the language that we want them to use, that would be accessible and user-friendly and comprehended by the public and marginalized communities in particular. Over. Thank you.
Thank you. Okay, I think I might take these slightly in reverse order. For the outsourcing of surveys, we would very strongly encourage you to try and do some language training, in particular with enumerators, or to make that part of your contract if you're contracting that out. We've got guidance, and it's part of the resources. It was one of the resources that I've shared on the resource slide around data gathering and the language issues around data gathering. There's also been some really interesting material written about some of the challenges and how to do quality assurance. I could look, and I'm very happy to, if you want to drop me a line, I'm happy to share with you some of the work we've done around quality assurance of surveys in particular, because you can build in a quality assurance kind of contract as part of your outsourcing arrangement to make sure that the agency takes it seriously and does some sampled back translation to make sure that they're getting across exactly what you want and expect in the process, and to make sure that they're gathering data and have thought about how to gather data from marginalized language groups. So there's definitely guidance around that, and I'd be really happy to talk to you more about some of the detail of that, and perhaps connect you with our data gathering teams as well, who have written some of the papers on that. The two other points that you raised, that one was around protracted emergencies, and did we have any recommendations around that? I'm not sure I fully understood the question, but I think our basic recommendations would be around taking the time to build up the language response and building up the capacity of the translation teams, where you've got time to do so, it's also it can be a benefit in the sense that you have time to build up a set of skilled interpreters and to start building up glossaries, sort of better designed glossaries, and to be able to do more field testing. The first period of a sudden onset emergency, you do as rapid field testing as you possibly can of the key information, but it can become more nuanced. Did I understand your question correctly?
Not really, but I think it's my fault. I should have articulated it differently.
No.
I was really related to one of the first slides that you shared was on the kind of modalities of communication. So what, in one of the survey questions you had, whether people prefer TV, radio stations, social media, I think, and hotlines, etc. So I was wondering, like in times of emergency, when you have hostilities, it would, sometimes the internet could be compromised. So do we need to, for emergency preparedness, do we already need to have some basic complaint modalities that are recommended to already start with? So before waiting to get, like to have community consultations, is there anything that you recommend just going ahead and starting with, like a hotline? Do we do the recorded modality, radios? So just to see if, just wanted to see if you had any thoughts on that.
Yeah, okay. I suspect the answer will be somewhat that it's case by case, but if literacy.
Okay, I can't hear anything. I'm not sure if you're muted or if I lost connection.
I'm not muted, but if you can't hear me, then that's no good.
We can hear Alice, Amal.
Okay, great. I hope you can still hear me as well. Okay, I was basically saying I think largely it's going to be a case-by-case situation, but if you know that literacy levels are likely to be low, and particularly if you know literacy levels are likely to be low for women, you might want to make sure that one of the first things you do allows some voice reporting straight away. So that could be the recording boxes, which don't need connectivity. It could also, of course, be some good partners who can provide you with, interpreters and safe spaces where women can go to. It doesn't all have to be technological based, but I would definitely make sure that one of the very early things you do is something which gets away from written form, where literacy is low. Mia, you might have more to say on this. Can I ask you to add any other thoughts?
Yeah, I think that's, just to add to that, perhaps, even in rapid onset emergency, we're used to doing multi-sectoral sort of like rapid onset assessments. And I think that some questions around communication preferences, even to communicate about sensitive topics, are important to include. So the list of questions that we shared there were coming also from the menu of accountability to affected people related questions that have been endorsed by IASC. So I think that, that's one thing to keep in mind, to be able to base whatever measure is put in place on some level of evidence, whether it is, as Alice was saying, on some previous knowledge or extant data about literacy levels and so on, or on rapid assessments that do include questions around communication preferences and needs.
And I'll use this opportunity to plug the new ISC results group 2 on accountability inclusion portal. If you're looking for that menu of accountability to affected population questions to pull from and get questions like communication preferences, you can go to the new portal that is listed on the resources in this presentation and find that menu and many more resources there. Over.
Thank you very much. That's really useful. I believe there was one question that you asked right at the start, and having taken them in reverse order, I'm now coming to the one that I'm afraid I'm going to say I didn't fully understand the question. I think it was about bringing together terminology to support work around prevention of exploitation and abuse, as well as accountability for affected populations. But I didn't quite understand the question around how it related to terminology. My apologies.
So thank you for that. Thank you for taking the time. Questions. Basically, my question is about, like, since we're going or shifting towards AAP all-inclusive approach, AAP including PSEA, and a lot of the communications that we do with communities and even during emergencies, communication strategies, etc., would naturally involve both AAP and PSEA messaging. For example, the recce that we had during COVID-19, we also shot out there some messages, generic messages on PSEA, etc. But the way we wanted to do that was basically in a way that would address stigma. So it's, it kind of, and it really links into what you were saying about sometimes being forced to use terminology that's not sensitive to, or it's not the appropriate language or the language we want to use, case in point, sex workers versus prostitutes. But sometimes we end up doing that because it's something that would reach the people, reach the communities better, and be better understood and received. So in terms of PSEA, here the stigma against anything that has to do with sexual relations is very high. And using plain language, I'm not like, I was just wondering, since we're using the same communication modalities for AAP and PSEA, and because there's a lot of stigma, has there been an approach to kind of generate language that would address both AAP and PSEA? So, for example, humanitarian assistance is free of charge. If you have any complaints about the quality type or quantity of the assistance or the person delivering the assistance, including any sexual exploitation incidents, please report to this number. So I was wondering if this is like kind of an approach that's being we're consciously steering towards, or are we still kind of working on PSEA in separation of AAP or the rest of, the AAP related work streams? Over.
Okay, thank you. Now I think I'm a little clearer. I think the general move is towards a more integrated mechanisms for both of these. I'm going to bring us back to the language specific piece of that, which is to say that in some contexts where we've worked, there has been a move towards making some of the messages more neutral, I suppose, or taking away the things that people found objectionable by saying things like, have you been treated respectfully and with dignity? Have the aid workers working with you in a dignified way? Has anybody, aid workers should not do anything to dishonor you. So there's been times when there's been a deliberate change of the modality of expression to make it less problematic in cultures where having words like sex in there were unacceptable. Having said that, we also really believe that you should try and be absolutely as clear as you can, and it kind of can go a bit contrary to plain language principles to be trying to disguise what you say under words that aren't actually saying what you want to say. So we would encourage you to be as direct as is possible, and it may mean creating different messages for different locations and audiences. So, if you've got a safe space that's a women's only space, can you use some terms that are more direct so that there's no ambiguity at all, leaving the kind of more politically neutral words for a wider access audience? Mia, that's my first thought, and I know we really struggled because we wanted to get some really in-depth research in Yemen about this. What I would say is that lots of the resources are available around reporting mechanisms, and PSEA are now available in Arabic. So there's an increasingly good sort of set of terminology and sort of phrasing available. So certainly finding material in Arabic and in Arabic that's been tested for different parts of the Arabic speaking world is available. It's just obviously it's a very diverse world and with very, very many different kind of cultural norms. Mia, anything you wanted to add to that?
No, I think that sounds quite excellent and comprehensive as an answer. I would perhaps encourage people to going back to the case study that Alice presented on our work in Cox's Bazar and the Rohingya response. The Shangjog platform, which is shared in the resources where all of the PSEA and AAP related resources that we've developed there have been shared, is quite a good website where to look for examples of what has been done in other contexts. And I think that this issue of trying to bridge the PSEA and AAP gap, so to speak, has been quite carefully taken into account there. I'm slightly aware of time, but we still do have time for some questions. So I don't know if there are any other questions. Georgina, I still see your hand up, but maybe that might be from earlier. I'm not sure.
Sorry, I'll just put it down.
No worries. Any other questions, perhaps?
No, maybe people feel like they've got enough from what's being given. Mia, I'm going to just say that I can't see the slide with our details on it, but I understand that other people on the call can. So I'm going to assume that people have the details of myself and Mia, and you're very, very welcome to write to us both to get a copy of the slides or of the recording, or to ask any further follow-up questions. We're both very, very happy to take questions.
And I can reiterate that, speaking from IOM's perspective, Translators Without Borders has been an absolute pleasure to work with, and they will respond to any questions that you have. So if there are no further questions, please do jot down the names and email addresses of Alice and Mia, and you can write to them directly. As Alice said, for the presentation or additional questions that you may have. I would like to thank Alice and Mia for both the organization and the presentation today. Always a pleasure to learn from you. And thank you to everybody for your time on this webinar for this important topic. So thank you very much. We'll close up now. And wonderful day to each and every one of you. Bye.
Thank you very much.